Now we're going to discuss the ocular pathology. So it's basically the abnormalities that are related to the eye that we're going to discuss over here. Now we've already gone through the different causes that can basically result in the vision loss. This vision loss can be the partial vision loss, or it can also be the complete vision loss or the complete blindness in the individual, in which even the finger counting or the hand movements cannot be assessed by the patients, and the light reflexes or the pupillary reflexes are even absent in that individual. So when we talk about generally categorizing the different causes that can affect the visual acuity in the individual, it can range from the factors that are related to the cornea and the sclera, that is the outer anatomical structures, the superficial structures that can be affected anatomically, and then we have the internal causes that can range from the retinal health. We can also evaluate the retinal health. How is it basically evaluated? We go about and perform the ophthalmoscopy or the fundoscopy in that particular patient, and this is how we basically examine the vessels, the vasculatures, the fovea, the macula. The optic disc is managed, or it is evaluated over here, just to know the general retinal health over here, whether retina is involved in the vision loss or the blurring of the vision or not. Then if there is no problem if there is no abnormality detected at the retinal level, and still the patient is complaining of a blurred vision or a decrease in the visual activity, basically we're going to perform some tests just to know if the occipital lobe is affected, and if the interpretation by the brain of the certain messages that are sent off by the optic nerve are not interpreted in a proper manner. Now there are the range of causes that can relate to such blindness or such vision loss. It can range from the infectious causes that basically range from trachoma, onchoriasis, syphilis, leprosy. All of these are the leading causes, the leading infectious causes that are ending up in the blindness or the complete loss of vision over here. So how do you basically go about and document ocular pathology? It's again very important. You're going to document, you're going to know the complete history of the individual. You have that patient at your hand. You're going to note down the age, the sex, the gender, or then you're going to move on towards the family history, the presenting complaints, the history of the presenting complaints, how long, what was the onset, and what was the duration of that presenting complaint. That is going to be noted down in the documentation of the ocular pathologies. And then you're going to move on to the past surgical and the medical history, which is again very important. Knowing the medical history, you're going to document basically whether the person is suffering from some sort of diseases, long-term chronic diseases, such as it can be diabetes mellitus, hypertension, hyperlipidemias. All of these can relate to loss of vision or the blurred vision in the individual. Then any surgical history, use of contact lenses, any trauma that has to be noted down by the physician whosoever is taking the history in that particular individual. And then you're going to move on and take the family history of any history that is related to the macular degeneration, strabismus, then we have the retinal detachments. So all of these, glaucoma is one of the diseases that can travel genetically or that have their familial indications in that particular person for whom we are talking about. So photographic evidence is again very important, and we'll be discussing the kinds of the photographs that we're going to take in that particular individual for whom we're going to talk about. Then the factors to consider for that particular cause while we are documenting the ocular pathology. What are the other factors that we can consider about that particular disease that we are going to investigate in that particular patient? Now, regarding the clinical examination, one should know that usually the naked eye examination is not carried out for the eye examination. Usually we have this slit lamp as shown in the picture. It's usually carried out through this slit lamp just to have a closer look at the eye and the structures in the eye. It can be the cornea, it can be the pupils that can be looked for when we are evaluating a person, and make him sit on the slit lamp with a better focus, with a better lighting, That is how it is performed. So slit lamp biomicroscopy is the method that we used, that is particularly used even today for the clinical examination of the eye. Ophthalmoscopy or the fundus examination is another technique for viewing the retina or the getting the view about the retinal health of the individual. When we're evaluating the retinal health, the structures that we have to focus on are the fovea, the macula, we have the optic disc at our hand, and then we have the other vasculatures that are surrounding the fovea and the macula. It can be a diabetic retinopathy giving out a cotton wool appearance that is quite significant in the diabetic retinopathy that we'll be studying accordingly in the relevant section. So these are the findings that you have to document while you are clinically examining an individual. You are clinically examining a retina of the individual or the other presenting structures in that particular individuals. Now there are different grading systems that are devised for this section. Then we have the cataracts, that is the LOC3 grading system, CSP it is known. And then we have the optic nerve cupping, that has to be, there should be a physiological cupping at the optic disc, and it is basically shown when we are carrying out the ophthalmoscopy or the fundoscopy. If it is absent, you have to document it down that the optic disc was not appropriately cupped or physiologically cupped. It can be the pallor of the optic disc that can also be noted. You have to basically differentiate the normal from the abnormal. So knowing the normal is again very important when you have to differentiate from the abnormal features in that particular person. The retina is basically examined for the disease specific. As I've already mentioned, in diabetes, we have the cotton wool appearance in the individuals that is basically spotted down on the retina. And then we have the ARM, that is the retinal degeneration. It can also be managed or documented over here. The documentation of the pathologies, it includes the rating by the clinicians, and it tends to be poorly standardized and inconsistent. So usually there is a lot of variation from one physician to the other physician. So the standardization is quite poor over here. Major emphasis on the photo documentation. So it's quite important. While writing it down, sometimes you don't add on features to your writing. But when you document your writing along with the photograph, it's sufficient for the evaluation at any other time, at any other place, by any other physician. And it's quite convenient. The use of the reading centers to grade pathologies is again very important over here. So the general level of the photographic quality is again very important in the medical community. It's very low for the research studies. Extensive training and certification of the photographs is quite important while we are discussing this. Basically, the quality of the picture is again very important when we are photographing a patient. It's again very important to use cameras with high quality. Reading centers are very effective in studies of the diabetic retinopathy. Subjects diagnosed prior to the entry and reliability of graders for the large numbers of patients with mixed disorders is quite unknown over here. So basically in this section we summarized the different sorts of ocular pathologies and how are we going to document these ocular pathologies. That is what we discussed over here. So that is the end of this section. Thank you for watching sqadia.com.